Hi guys. So we have discussed the phases of healing for soft tissue injuries, but now we're going to talk about the different types of soft tissue injuries that we see. Okay. Now keep in mind, these are just a handful of the types of injuries that can occur to soft tissue. Okay. And keep in mind that you can also hurt more than one soft tissue structure at a time. Okay. So going to your slides, we are going to start on slide number 8 that talks about the different types of injuries, okay? There are several, okay? Several. So I've broken these down into a slide for each injury. So the first one that we see is the most common, okay? Sprains and strains. Now here's the key. Sprains are going to occur to ligaments. Remember, ligaments connect two bones. Strains, T for strain, T for tendon. Strains occur to the tendon, which is the tissue that connects a muscle to a bone. Okay, sprains occur all the time. They occur outside of athletics, walking in the hallway. I'm sure most of you have experienced this at a time. Okay. Sprains and strains are usually classified as on a grading system. Okay, they are either a grade 1 for a injury that's just to a few of those fibers, muscle fibers. Remember, each structure has thousands and thousands and thousands of fibers. Grade 2 is there's a lot more fibers torn, but it still has a good significant amount. And grade 3 is when they are completely torn. So that rubber band has completely torn in half. Okay. The picture is just showing you kind of what the signs and symptoms of a sprain are. Okay. You see a lot of swelling, a lot of those normal just inflammatory signs. The second one that we have is an incision. Okay. Most of the time you will only see an incision in the operating room because an incision occurs from a scalpel. Okay. It is a purposely put opening to the body. Okay. You usually just see when there's surgery. Okay, so if you can see on the picture, somebody actually used the scalpel to open up those holes on the person's ankle. Okay, but it is still going to be a trauma because you've cut through that tissue. Okay, you've cut through the skin. The next one we see is very common. It's an abrasion. Okay, I'm sure most of you have gotten this before. Okay, floor burn, carpet burn. Okay, sliding into a base. We see these all the time. Okay. An abrasion occurs when you have scraped off the top layer of skin, okay? You don't usually have any damage to the muscle, tendons, or ligaments or anything like that. It's just going to be those top couple layers of skin. Contusion, very, very common, also known as a bruise, but we're going to use our big words and we're going to say contusion, okay? A contusion is going to be just a increase in blood flow that causes that discoloration. Okay, you've hit something or something has hit you and the blood has pooled in that area. Okay, and that's what a bruise is. That's what gives it that dark coloring, is because there's an increase in blood flow to that area. The next one is a laceration. We see this quite a bit. A laceration occurs from a jagged cut. Okay, it can be anything. It can be a cleat, being stepped on by a cleat. It could be hopping the fence and the fence cuts you. It doesn't matter. It's just any jagged cut that does go through the skin. Okay, and so this, we kind of get into a little bit more of a situation where it can be deep enough that it does cut tissue, like the muscle. It can cut tendons. It just depends on how bad it is. Okay, so lacerations are a little bit harder on the healing than an abrasion is. Our next one is avulsion. We will see avulsion again when we talk about bones, but an avulsion is a tearing away of the tendon or the ligament from where it attaches to the bone. Okay, so on the picture, you can see on that thumb that tendon or that ligament is pulled away. Okay, and it's so because it is unattached, it is an injury to the soft tissue, but with this it also peels away a part of the bone, and so that's why we will see this again when we talk about bones. Our next one is super not common. We will not deal with this, but it is definitely considered soft tissue. It's also considered a bone injury, but we have amputation. Okay, we see that the body part has been completely removed. Okay, most of the examples that we're going to see here is like in hockey. Okay, when a ice skate has severed a finger. Okay, sometimes this can even happen in basketball if somebody is jumping and their finger gets caught on the rim. Okay, but definitely not something that we see a lot of. And the next one that we have is a puncture wound. Okay, a puncture is going to be something has penetrated through the skin. Okay, most of the time we see this like when we step on a nail. Okay, or if somebody stabs you with a pencil. Okay, just that nice, it's not jagged like a laceration. Okay, but it's gone through the skin. And so you can see the picture. It shows that the nail in this case has gone through, and it's gone through the skin, through the fat tissue, and all the way down to the muscle. Okay, so unlike the laceration, which is jaggy, this is usually a little bit more of a pointier surface. And then our last one that we have is contrecoup. Okay, this has to do with our brain. Okay, we see this when we deal with concussions. If we get hit in the front of the head, which is showing you from this picture right here, okay, there is an injury at that site. Okay, but because our brain is kind of floating around in our skull, the momentum from that hit causes the brain to go to the back of the head or the posterior of the head. And so now we have an injury on the anterior side and we have an injury on the posterior side, which is the contrecoup. All right, so this is going to be an injury to the opposite place that the site that the injury site occurred. Okay, so I get hit in the front of the head, but I'm having symptoms in the back of my head as well. Okay, I know we ran through that fast, so use this as reference. We will come back to these, and next time you see me, we'll be talking about bone healing.